I'm Dr. Emma Gray and I'm the lead clinical psychologist at the British CBT and Counselling Service. And in this video I'm going to talk about the best treatments for depression. Now by 2020 depression is going to be the second most disabling condition after heart disease. Currently we have two treatments that are effective, medication and therapy, and I'm going to look at the advantages and disadvantages of both. Let's start with medication. So the biological origins of depression are still relatively unclear. Some biological factors have been identified as important, but despite a lot of research, a single biological cause has yet to be pinned down. And this of course makes developing a medication that's effective for everybody is quite hard. So the process of prescribing medication, getting the dose right, is often a process of trial and error. The advantages of medication are that it's relatively faster to have an effect. So most people will get the full positive impact after about 6 to 8 weeks. However, some people can start to notice a difference after 2. Medication's readily available. Your GP can just prescribe it for you. And there's no time investment, no self-exploration or life changes are required. The disadvantages of medication are, as I've said, getting the right drug at the right dose is hard sometimes, and then not everybody is going to notice the difference. These medications don't work for everybody. And there are some side effects, including weight gain, sexual dysfunction, gastrointestinal problems, and you can feel quite drowsy on these medications. Now over time, some of these side effects can lessen, but some still do persist. The final disadvantage is these medications don't resolve the underlying cause of depression. So often when you stop the medication, your problems will return. The alternative to medication is therapy. Currently, the most effective therapy for depression is cognitive behavioural therapy, or CBT. The advantages of this type of therapy is that it helps you to resolve the underlying problems. So over the longer term, it's more effective than medication. It can also help people for whom medication didn't work. The disadvantages of therapy are that it does require a time commitment, it does require self-exploration, and it does require life change. It also takes a little longer to work than medication. In terms of my recommendations, both medication and therapy are legitimate treatments for depression. But what I would recommend is that if you're struggling with mild to moderate difficulties, you try a course of cognitive behavioural therapy. If your problems are more severe, and by severe I mean that you're struggling to function on a day-to-day basis, I would start with a combination of medication and therapy, and then over the medium to longer term, work to reduce your medication and continue with your therapy. I hope that I've been able to answer all of your questions on this topic, but if I haven't, please post them in the comments below and I'll do my best to help. And I'll see you soon.